Recently, we created a presentation about a pre-billing checklist and best practices for preparing your claims data for submission. All the EMRs have a various workflow that stop a claim from going if there's missing data or an error that the EMR picks up. So it's really important that everyone in your hospice or home health is trained on the EMR and understands where data goes, what data could be missing, how to clear those errors. But there are some pieces that sometimes are not present in that workflow. You want to be certain that you have that patient in your system under the right payer, that you verify that eligibility for that payer for that particular date of service, because payers do change. People become Medicare eligible when maybe they were Medicaid or commercial insurance prior. Then there's the clinical side. So you want to be certain that you're meeting all the clinical requirements for billing so that all your notes meet requirements and everything is documented correctly. And one item that is really important is to make certain that your death visits, so when a patient is a hospice patient and the nurse maybe goes out and takes care of that patient at end of life, that visit is only billable, of course, when the patient is alive for care. And then once the patient passes, there needs to be a separate visit with a PM modifier. And the reason I emphasize that is super important because under audit, Medicare has found many visits that aren't documented that way. So they're paying you for time that was supposed to be for direct care when in fact the patient had already passed away and the time gets captured in one span. So having your data technically correct is absolutely a must. Every month, every visit, especially at end of life, needs to be assessed and determined that you are actually only billing for the time that you gave direct care and that any postmortem visits are documented as such. Super important. You don't want your denial rate to go up because you just didn't follow a process of closing a visit and then opening a new visit for postmortem care.